Elliotdale for screening, testing and awareness campaigns. Health MEC Sindiswa Gomba is leading the campaign. A case of COVID-19 was confirmed at the Madwaleni hospital. Our reporter Athule Joka and cameraman Lwandile Mbu-lali are in Elliotdale with the testing teams. Thanks very much for joining us, Athule. Just tell us what's happening where you are.
Well, greetings to you in studio and a warm welcome to SABC News viewers across the lands and depths of this country. Well, today we are at Fameni village in Xhorha in the Eastern Cape. We are told this is the second place where a second case of COVID-19 was confirmed here in this village when a young lady who was traveling from Italy admitted herself in a local Madwaleni hospital. That's when she was tested, and then it was found that she tested positive for COVID-19. And since then, there's been speculation going around in the social media and people saying all sorts of things. So the minister is here, the MEC is here today to try and allay fears on the community here, to try and also to conscientize them on this virus. And also they are here with this mobile unit, testing unit, to try and do screenings, to do testings, and also to strengthen efforts on awareness campaign here in Fameni village. I am joined by MEC of Health, MEC Sindiswa Gomba. MEC, just to elaborate today about today's proceedings.
Well, today's proceeding is a response to the national call by the President that there should now be mass testing with a target of 10,000. And for that reason, as the Eastern Cape, we took the liberty of what has been provided to us by the Health Minister, the vans, where we're able now to harvest our specimen and take them to the laboratory without them being spoiled. Secondly, we were looking at how we can actually achieve our own target. Our target, as we look at it, can easily be achieved if we're actually following those who have been positive. And if we follow those who have been positive, in a sense, we are extending the net of the contacts. It then suggests, therefore, that equally, as we are lucky to have a particular person from this village and localization who has been prepared to actually speak and make herself a particular person to attest that indeed she was positive and she is now negative after the isolation in Madwaleni Hospital.
Have you also tried to trace those individuals who may have come into contact with this young lady?
We're lucky with her because we managed to get all the contacts that she indicated. First and foremost, her family. Secondly, those, except that, unfortunately, we could not trace everybody who was in the buggy that she took to the village. However, we have set the net wide to say whoever want to believe that one has got symptoms, those people should avail themselves to the nearest clinic so that we can look at screening them, and ultimately, if anything is suspicious, we go for testing.
And also the issue of stigmatization is also very prevalent, especially here in the rural areas. How are you also looking to allay fears on the people and also to try and address that?
Our first step is making people understand that ordinarily this is looked like as flu in the first instance. So for flu, there's nothing that says you are stigmatized. But then again, because it is now seen as coronavirus as to its origins, it then suggests that it is a stiff flu where it affects your breathing, it affects you, and you have got muscles that are a bit sore, and equally that you are looking at your nostrils and your throat. Those issues for us are quite important that people follow them before they get sick.
And also those people who stigmatize those who are tested positive as well?
I don't think it's about stigmatization more than fear. People are just anxious because the first thing is that it does not have a cure. The second one is that people are actually abusing our communities by sending messages on Facebook and social media. And in so saying, those issues that they say are not tested nor verified. But we're appealing to our people to listen to what government is saying, to follow the conditions and the regulations that government lays down.
Thank you so much, MEC. We also are joined by the MEC for Education, Lwandile Mbu-lali. MEC, you are also here. Maybe if you can speak on the schools, when are they reopening and how are you planning?
No, we are within the declaration made by the President. We are not going to open up schools up until a national decision has been made, because this is a national call, not a provincial call. Remember, all schools are provincial schools, but located in villages.
Thank you so much, MEC.
Thanks a lot.
Well, those are the joint MEC speaking to us about proceedings for today. Well, that was the MEC for Health saying they are here to raise awareness on this COVID-19 and also trying to allay fears on people and also the stigmatization that is going around, banded around here in the rural areas. And also talking to the fact that they are here with this mobile testing unit to do screening and also to do testing. We also tried to rope in the MEC for Education who spoke on the issue of education. You do know that not so long ago we're at this village where learners were complaining about the issue of online learning, saying they cannot access online learning because they do not have those resources. So from myself, Athule Joka, and colleague Lwandile Mbu-lali, studio.
Thanks very much, Athule, for that report. And this is where we say goodbye to